काफी हद
हाँ।
तक इस चीज को कंट्रोल कर सकते हैं। सेकेंड थिंग ये है कि हम डिफरेंट जो दूसरे हैं उससे रिलेटेड, ट्रीटमेंट से रिलेटेड या सोशल जो इमोशनल जो प्रॉब्लम्स होती है पेशेंट को ट्रीटमेंट कैंसर डायग्नोज होने के बाद,
हाँ।
तो उसमें भी हम हिप्नोथेरेपी के द्वारा जैसे फोबियाज है, एंजाइटी है या फियर है, उसको रिड्यूस करके ट्रीटमेंट के जो डिफरेंट थेरेपीज हैं उनके ट्रीटमेंट को और रिस्पॉन्स को इंक्रीज कर सकते हैं पॉजिटिव अफर्मेशन दे के। प्लस जो
आपने
ट्रीटमेंट है
डॉक्टर,
उसके साइड इफेक्ट्स को कम कर सकते हैं।
हाँ, आपने डॉक्टर द्विवेदी और एनपी दुबे का नाम सुना होगा, कैंसर हॉस्पिटल
अरे
गवर्नमेंट।
सर, द्विवेदी सर तो पायोनियर थे सर।
तो
इंदौर में
डॉक्टर
कैंसर
द्विवेदी,
जो कुछ भी आज द्विवेदी सर की देन है।
तो डॉक्टर द्विवेदी और एनपी दुबे मेरे पास आए हैं। दे हैव ऑब्जर्व्ड रिमार्केबल चेंजेस टेकिंग प्लेस इन टर्मिनल
जी
कैंसर
सर।
पेशेंट. I could control intolerable pain instantly by giving positive command, and the pain impulses were unable to reach to the brain, resulting no pain. And the patient started smiling, whereas it was the comment of Dr. Dwivedi that he has to be given darafilin or fortwin injection to control that pain.
पैलेटिव सेटिंग में भी डेफिनेटली सर बहुत इंपॉर्टेंट रोल हो सकता है। जैसे पेन रिलीफ हुआ, कई बार
हाँ,
ब्लीडिंग होने लगती है, उसमें रिलीफ करने के, पेशेंट की एंजाइटी को कम करने के लिए,
हाँ,
फियर ऑफ डेथ को भी थोड़ा सा रिड्यूस, काफी हद तक उसमें हिप्नोथेरेपी का रोल हो सकता है इन सारे एस्पेक्ट्स में।
हाँ, क्योंकि क्या है डॉक्टर साहब, मैंने एक बात देखी है, जनरली इट इज द फोबिया ऑफ कैंसर which is responsible for aggravation of the cancer disease. The disease does not precipitate to incurable stage unless until patient does not support with his negative affirmation, self
यस सर।
affirmation. That because cancer word itself indicates that life is short and indefinite. So every day when patient goes to sleep, he carry a negative suggestion that now day by day I am near to death. So he gradually developed vicious circle which requires instant control. So what I personally feel, the cancer cells are mutate, rather they increase in number because of the cooperation given by the patient's mind by negative affirmations. And this process is done during sleep hours when patient conscious mind is not aware, because our subconscious mind has no judgment. What conscious mind thinks, subconscious implements. So during delta waves, the patient carry one constant hammering of negative suggestion that now I will not live longer, now I will die at any moment. So he himself is responsible for inviting death before the aggravation of cancer. So the number of patients with different cancers like liver cancer, kidney cancer, skin cancer, I found that in skin cancer, emotion is very much closely connected with our emotions. Can you hear me?
यस सर।
So our emotions are very closely connected with the skin problem. So by giving positive affirmation, we can control those negative emotions, and we can definitely arrest the progression of skin disease related to cancer.
यस सर।
So immunity in whole of the world, like in COVID-19, no Ayurvedic, no homeopathy, no allopathy, no medicine. There is no medicine which can claim improvement of immunity, because antibodies are badly affected by your will, by your negative affirmation, by your fear factor in the mind. And by hypnosis, if you can overcome phobia, by hypnosis, you can, if you develop strong willpower, I think your immunity, your antibodies will multiply very fast. What I personally feel, what is vaccine? The role of vaccine is patient's own positive visualization that now I am developing antibodies in my body. Hello?
इम्यूनिटी बढ़ती है सब चीजों में से बेसिकली इम्यूनिटी का बहुत ज्यादा इंपॉर्टेंट रोल है एवरी टाइप ऑफ डिसीजेज और
No, so this immunity is enhanced only by patient's self positive affirmation with visualization
यस सर
during burst of alpha level, because in alpha level your acceptivity of the mind is more better in comparison to beta level. There should not be any involvement of the conscious mind, because voluntary control can have only effect on involuntary when you achieve alpha level. Acha, what I personally found, the neuroplasticity and neurogenesis is possible only in deep hypnotic trance, that is somnambulism state, when burst of delta waves takes place. Then a thought can convert into an action as per your desire action inside the subconscious. So that's why I thought, why not to start my first lesson on role of hypnosis in oncology. Now every day I will be taking different topics, so that after 30 or 40 days, one book will be ready on clinical experimental hypnosis with transcripts. So I will be writing on this, on this group every day, because in Indore there is a lockdown now from today. So I don't want to waste my time. Every day I will take some time only to write these experiences, so that everybody can have a book ready in just 30-40 days. That will be disease wise. Like in migraine, I have wonderful results in controlling migraine. What happens in migraine? There is serotonin and histamine chemicals are badly affected due to deep-seated stress, and hand becomes cool, head becomes warm. So while treating 4,220 cases in my last 20 years, I found why these changes are taking place, why hand is becoming cool and head is becoming warm. So I got one idea: if I reverse the process, if I can bring warmness in the hand, and if the head becomes cool, this reverse process can reverse migraine disease. So many of the patients, I told them to imagine their hands are becoming warm. I told them, your hands are becoming warm, warmer and warmer, warmer and warmer. And they saw on their mental screen that their hands are becoming warm. Instant relief in migraine attack was observed by many patients. So this paper I presented in Mysore University, and I was given best paper presentation award because of these findings. This was based on some 325 patients of different age group. So I found that from headache to cancer, hypnotherapy has definitely wonderful role, because patient is not treated by hypnosis, patient is relieved when he is in hypnosis. It is not the role of the hypnotherapist, it is the role of the patient's subconscious mind. Conviction is conviction. When patient is convinced for the therapeutic effect of his own positive affirmation, the same moment recovery starts. Now it depends what is the percentage of faith in the patient's mind. If there is a doubt, recovery will be slow. If there is no doubt, recovery will be fast. So hypnosis के अंदर I have seen that any disease, whether it is myopathy, like in myopathy, neuropathy, medical in medical field, homeopathy, there is no treatment of myopathy, neuropathy, and arthritis. It is 1 in 50 lakhs. In arthritis, the subclavicle and popliteal pulses are absent, and patient goes in critical condition, and there is no pulse, there is no BP. Dr. Sharad Pandey of Bombay Hospital said patient is clinically dead. He gave in writing to the parents, to take the patient is clinically dead. But if your parameters are not showing that patient is alive, that doesn't mean dead words should be heard by the patient who is unconscious. Because he is not conscious, but that doesn't mean his mind is not receiving negative suggestion. So when I restored one lady from coma stage, she was declared clinically dead. She was brought by a special charter plane from Ichal Karanji to Indore, and in just 7 days, she opened her eyes. So, Acha, Dr. Arun Verma, who's MBBS, he was with me for 5 years. He made all the assessment regarding subjective, objective changes taking place in all the patients. I told my all students, I told Dr. Vivek Mantri, I told many students who are on the group that whenever patient comes to you, you must know one allopathy doctor who can examine the patient and can give you the report before commencement of your treatment. Then when patient after 1 month reports improvement, then again send that patient for re-examination by that doctor, so that you can have a scientific assessment of his progress. We cannot prove scientifically we have improved or cured a patient unless until it is not documented by a medical doctor. So what is your comment on this?
Sir, can I ask something?
हाँ,
सर जो पेशेंट कोमा में होता है वो कौन सी स्टेट ऑफ माइंड में होता है?
कोमा में तो ये है कि मान के चलो देर इज नो रिस्पॉन्स टू सजेशंस, but in coma also, if there is a hammering of constant positive affirmation with some sound, there are some binaural sounds available, and those sounds are the frequencies which can be heard when a patient, even patient is in coma stage. So if those sounds can be heard by the patient, that is known as binaural beats. It is available on YouTube. There are different beats which has been discovered by scientists, and these beats are very similar to those sounds which are produced by the organs inside the body, by the mind. So if the patient hears those particular frequency sound, and if those sounds are heard by the patient may start improving in his consciousness. We have treated many coma patients. In the beginning, for a few days, they do not respond, but after constant positive affirmation with particular sounds, we use different frequency sounds. Like there are sounds like regeneration of neurons. There are sounds on activation of neurons. Then many other sounds. So I found that if the coma patient is with the ear plug, is hearing those sounds, 1 or 2 sound can have a very powerful effect on the patient's mind. And if there is a will of patient to come out of that coma stage, that will is very important. Then listening to that sound, he will start making his efforts to come to the consciousness. At that time, if my positive suggestions are heard, he can open the eyes. So it varies from patient to patient. Myself and Dr. Anita, we have visited many ICU where we have been invited as expert doctors to bring patients out of coma. There was one lady in Indore, she was in coma from last 20 years. And she herself was a medical doctor. Dr. Rajan must be knowing. She was the owner of City Hospital in Rajmohalla. But the problem was the other member of the family, being a doctor, they were not having faith that any other therapy can help the patient to come out of the coma. Sometimes this misconception does not allow us to help such patients. But mind power cannot be expressed in words. Wherever I had 1% doubt whether I will be able to help that patient or not, it became very difficult for me to help that patient. If I am 100% confident, patient improved very fast. If you think this case is very minor, with minor problem, if you get this thing, if this suggestion goes to your mind, this is a simple headache, you will cure within 4-5 sessions. That means the patient may take long time. And if you bring, no, I will treat, he will cure, this will help you more. So one should not be overconfident for any case, whether it is minor or major. Any other question?
Sir, I have a question. It's not a question, but with your due permission, as you mentioned, पेशेंट्स जो होते हैं कि आपने बिल्कुल सही कहा कि सबकॉन्शियस माइंड में बहुत ज्यादा पॉजिटिव जब जाएगा तो पर्सन कैन कम आउट ऑफ कैंसर और एनी डिजीज विच इज एब्सोल्युटली अ ट्रू फैक्ट. बट पिछले बार भी जब मैं डॉक्टर राजन यहाँ पर थे तो मैंने उनसे एक ही कहा था, एंड विच आई बिलीव स्ट्रांगली, that a patient doesn't die because of diagnosis, he dies because of the prognosis which has been done by the doctor. क्योंकि आपने जिस तरह से बिल्कुल सही कहा कि पेशेंट की इच्छा शक्ति अगर है तो वो ट्रीटमेंट को रिस्पॉन्ड करेगा, चाहे फिर वो कोई भी पैथी हो, एलोपैथी हो, हिप्नोथेरेपी हो, एनीथिंग. बट होता क्या है, most of the times the person, with due respect to Dr. Anjani and other doctors in the group, the person who has worn the white coat, they generally give out a statement that you are having only 3 months life, you are having only 5 months life, which is really not a good way to communicate with the patient. This is a wrong way, because patient dies because of the prognosis, and doctors honestly don't have any right to do the prognosis. इस बात पर मेरी बहुत से सर्जन से अब तक बहस हो चुकी है. So it should be actually made mandatory that doctors should not give prognosis. They have rights only to do the diagnosis. Prognosis करना भगवान के हाथ में है. This is my personal opinion.
Vivek, I agree with your comment.
I agree with you, sir.
I agree. I worked with Dr. S.K. Mukherjee. Rajen Anjane must be knowing his name.
Yes,
he was
sir.
one of the eminent physicians, not only of Indore, but of India. The name which he has gained. I used to sit at Manorama Ganj at his clinic every day for 2 hours. And I saw the medicine was in his tongue. He used to tell the patient, don't worry, your problem is very minor and you will recover very fast. And I have seen miracles at his clinic. And when I went to him for learning, I just told him, Doctor, I want to sit and observe in what way you are helping the patient. He said, I won't mind, you can come every day between 5 to 7 and sit and observe. So he used to call me Sudhir. Come Sudhir, sit and observe. After 4 or 5 years, when he saw that I am very regular, punctual and learning what he is doing with the patient, he used to consult patient for hours. And when patient asked for the fees, he used to tell the patient, as a medical doctor, unless until I don't prescribe any medicine on my letterhead, I have no right to charge. So many patients I referred him, he said, Doctor Sahab, I cannot charge because I have not given any prescription, I have not mentioned any medicine, I have just given consultation. So I said, even consultation should be charged. Bola, no, consultation is my consolation. How I can charge for consolation? So I touched his feet. He was the real doctor. And
सर
the
बस 5
experience
एक मिनट और बचा है.
हाँ, तो ये अपने सब डिस्कशन है. अपने को तो एक ही है कि now next Thursday I will be coming how to develop the ability of telepathy power, because Monmi has developed subconsciously, but I want you should develop consciously. So I will guide you some tips. Practicing those tips, everyone can develop telepathy ability, and there is no problem of net. When you develop telepathy, you can send the message whether Wi-Fi or internet available or not. और 5 मिनट बचे. और किसी और कौन कौन है भाई आज मौजूद? हाँ अनीता,
आज गीता भी है, इंदु है, चारू है,
तो
प्रियंका
आप
है.
गीता, अंजू,
प्रियंका
तुम
कुछ
सब
पूछना है
लोगों
बेटा?
ने, हाँ, हमारे डिस्कशन से तुमको सीखना है, बिकॉज आई विल बी टॉकिंग
प्रियंका कुछ पूछना
अबाउट
है?
हिप्नोथेरेपी.
मेरा ना आज नेटवर्क एकदम नहीं काम कर रहा है, तो इसीलिए मैं वीडियो ऑफ कर रखी थी. हाँ
नहीं, लेकिन तुम्हें सुनाई तो दे रहा है ना?
हाँ सुन रहा है, इसीलिए मैं ऑफ
और
करती हूँ.
तुमको हमने कलकत्ता हाई कोर्ट का डिसीजन भेज दिया. यू कैन राइट डॉक्टर बिफोर योर नेम.
ओके सर. हाँ
यू आर एलिजिबल. और अगर कोई ऑब्जेक्शन ले तो मेरे को उसका नाम एड्रेस भेज देना. ही विल बी इन प्रिजन इन इंदौर सेंट्रल जेल. आई हैव लीगल राइट. हाँ
बट उस अपने
क्योंकि
नाम के बाद
डॉक्टर-
लेकिन हिप्नोथेरेपिस्ट जरूर लिखना बेटा.
हाँ,
हाँ,
हिप्नोथेरेपिस्ट लिखना जरूरी है. देन यू विल बी safeguarded from my side, because you are
Okay.
doctor of hypnotherapy. You cannot simply write doctor before your name. You are eligible only when you write you are doctor of hypnotherapy, doctor of acupressure.
अच्छा ओके सर, पक्का.
है ना?
थैंक यू.
तो चलो भाई, सब लोग आए, मुझे बहुत खुशी हुई. when Anita told me everyone is present today, and next Thursday, अभी ये इसी टेलीपैथी का मैंने वर्कशॉप अनाउंस किया फेसबुक पे. 20 एंट्रीज आ गई हैं, एंड आई विल बी चार्जिंग 1500 फ्रॉम अदर्स, बट इट इज फ्री फॉर माय ऑल स्टूडेंट्स ऑफ हिप्नोसिस.
थैंक यू सर.
कब है ये? कब है
ये? अगले थर्सडे को, नेक्स्ट थर्सडे.
टाइमिंग
यही सेम टाइम,
अपना
थर्सडे एंड फ्राइडे.
8 से अपना सर 8 बजे से 8:45 तक.
हाँ, 8 से 8:45. 2 days, थर्सडे एंड फ्राइडे. ठीक है ना?
ठीक है.
जी जी सर.
और कुछ भी क्वेश्चन या कोई भी बात हो तो इस ग्रुप के ऊपर आप लोग लिख सकते हैं. आई विल रिप्लाई, बिकॉज एवरी डे आई विल बी ऑब्जर्विंग ऑन द ग्रुप. ठीक है?
सर
हाँ बोलो.
सर अभी हम लोग जैसे बात कर रहे थे कि डॉक्टर्स को पेशेंट को डराना नहीं चाहिए, तो जब से मैंने डाइट प्रिस्क्राइब करनी शुरू किया या लाइफस्टाइल ट्रांसफॉर्मेशन किया, तो इंडियंस के लिए बहुत प्रॉब्लमेटिक है अपने डाइट को चेंज करना या अपने लाइफस्टाइल को चेंज करना. तो इनिशियली मैं उनको पॉजिटिव ही बोलती थी कि हाँ इट्स नथिंग, आप ठीक हो जाओगे, आपको कुछ करने की मतलब ज्यादा प्रॉब्लमेटिक नहीं है, बहुत इजीली आप ठीक हो जाओगे. तो वो लोग नहीं फॉलो करते थे बिकॉज इट्स अ डिफिकल्ट थिंग फॉर देम. और फिर जब मैं उनको डराना शुरू किया तो लोगों ने फॉलो करना शुरू कर दिया.
नहीं, थोड़ा जरूरी होता है, बट इतना भी नहीं कि जो उसके मतलब वो डर उनकी बीमारी का कारण बन जाए. ऐसा नहीं करना है बेटा. बस थोड़ा तो जरूरी होता है, नहीं तो ये प्रिकॉशन नहीं लेते, और खास करके लेडीज बिल्कुल नहीं लेते अपने इंडिया में. ये बात तो पक्की बात है.
और उनको ये बोलो कि भाई जिन लोगों ने फॉलो किया वो ठीक हो गए. मैंने जितने भी लोगों को पहले गाइड किया उन्होंने फॉलो किया और जल्दी ठीक हो गए. आप फॉलो नहीं करोगे, टाइम लगेगा. तो गिव सम एग्जांपल्स ऑफ द पास्ट. ठीक है?
एक भी है मैडम, जब आप डाइट बोलते हो ना, वेरी ऑनेस्टली मैंने पिछले बार जैसे कहा था, डाइट वर्ड के बजाय फूड हैबिट्स यूज कीजिए, क्योंकि डाइट वर्ड तो शुरुआत ही डाई से होता है.
नहीं, I don't use diet or something with my patients.
Because it works
I
deep
just
level on the
use
subconscious.
lifestyle transformation.
लाइफस्टाइल ट्रांसफॉर्मेशन, फूड हैबिट्स, क्योंकि डाइट वर्ड जैसा डायबिटीज में भी शुरुआत ही डाई से होता है. One should never use the word diabetes. It directly hits the subconscious mind and इंसान और ज्यादा नीचे चला जाता है माइंड से. ये मेरा अपना मानना है, क्योंकि मैंने खुद के लिए यूज किया.
बहुत अच्छा चीज है, मतलब बहुत अच्छा पॉइंट पकड़ा है हमने.
जैसे अंग्रेजी नहीं, जैसे अंग्रेजी में डैड और मम, डैड और मम्मी, डैड और मम्मी, मम्मी मतलब तो हो ही गई डैड, और डैड को आपने पहले ही डैड कर दिया। तो इसलिए जो भावना माता और पिता में है वो डैड और मम्मी में नहीं है। आप समझे ना? इसलिए वर्ड्स का बहुत बड़ा इफेक्ट होता है पेशेंट के माइंड में। जैसा विवेक ने बोला है, आप उनको बोले कि भाई चेंज योर फूड हैबिट्स, इससे बहुत जल्दी रिकवरी होगी। पेशेंट को क्या वो सुना हुआ शब्द नहीं लगना चाहिए, उसको लगना चाहिए मैडम हैज कम विद अ न्यू अप्रोच।
यस सर।
हाँ, दिस विल हेल्प यू अ लॉट। एनी अदर क्वेश्चन? चलो, next Thursday and Friday I will be giving you practical tips how to develop the ability of telepathy. ठीक है ना? अभी मैंने उसमें थोड़ा सा उस पर प्रकाश डाला है, टेलीपैथी किनके बीच में होती है, लेकिन कोई भी डेवलप कर सकता है। One only has to be suggestible so that the other can have the acceptivity of the mind. So what are those conditions when you can send messages at your will and one can receive? For that there are some practical aspects which I will guide on next Thursday and Friday. ठीक है?
ठीक है सर।
Yes.
Okay. Good night.
Good night everybody.
आप सभी लोग
Thank you sir. Thank you ma'am.